Now I've made a video on PCOS where I explained everything about PCOS, the symptoms of PCOS, what causes PCOS, how you can know that you have PCOS, even unexpected symptoms of PCOS. I'm going to leave a link to that video somewhere above so you can go through that video, watch it, get to know about this condition, then come back and continue with this video. In this video, I'm going to focus on how you can reverse PCOS, or rather how you can manage the symptoms of PCOS so that you can get your period back and you can conceive if you're interested in having a baby. Hello everyone, what's up and welcome back. This is Everything Health with Nurse Dara. In this channel we get to discuss different topics related to health. If you're seeing this face for the first time, I am Nurse Chidera Cynthia. I'm a registered nurse, registered midwife, registered public health nurse, and a Bachelor of Nursing Science degree holder currently practicing here in Nigeria. If you're interested in this topic, keep watching. When most women get diagnosed with PCOS, they hear heartbreaking things. They hear things like, you'll never be able to conceive, you'll never be able to get pregnant, you'll never be able to have a baby. But I'm actually here to tell you that you can. You can conceive and you can have a healthy baby and a healthy pregnancy. Yes, you can. Now, how can you do that? That is what we're going to be discussing today. So we're going to be discussing how to reverse PCOS. Even though some women who are diagnosed with PCOS are not even interested in having a baby, they just want to get their period back and that's it. But then majority of the women are interested in having a baby. So when they hear things like that, things like you won't be able to have a baby, they just fall apart. Even though it might be quite challenging for women with PCOS to conceive, that doesn't make it impossible. They can still have an ovulatory cycle. So I always like talking about lifestyle modification before jumping into drugs. So let's talk about lifestyle modification. 1, weight loss. At least losing 5% of the body weight can help the condition. Losing body weight can help lower the levels of insulin and androgen, which is a major problem for women with PCOS. And reducing the levels of estrogen and insulin can also restore ovulation. Reducing calorie intake, carbohydrates. Reducing calorie intake can help reduce the levels of insulin in your bloodstream, and this is going to help a lot with the condition. And the third one is exercise. Being active is going to help a lot with this condition. It's going to help with weight reduction, and it's going to help to reduce insulin levels in your bloodstream as well. Now let's talk about medications. First of all, we're going to talk about the medication that can help you get your period back. Then secondly, we're going to talk about the medications that can help you ovulate. Then we'll talk about medications that can help you manage other symptoms of PCOS like hirsutism, excessive hair growth in the chest, jaw and all over your body, and acne. So let's talk about the medications that will help you get your period back. The first one we have is combination birth control pills. These pills contain estrogen and progestin, and they can help lower the levels of androgen. Now, androgen is a major hormone that causes all these symptoms that people with PCOS are having. So this combination birth control pills contains estrogen and progestin that will help decrease the levels of androgen, and by so doing it can help you get your period back. The second one is progestin therapy. Taking progestin 10 to 14 days every 1 to 2 months can help regulate your period, and it can also help prevent endometrial cancer, which is a complication for PCOS. And let's talk about medication that can help you ovulate if you're trying to conceive with PCOS. First, we have clomiphene. I already made a video about Clomid where I explained how to get pregnant with Clomid. You can check out the video. I'm going to attach the video somewhere above. Clomid is a drug that can help stimulate ovulation. Then the second one is letrozole. Letrozole also helps stimulate ovulation. The third one is metformin. Metformin helps to reduce insulin resistance for women with PCOS. Metformin is a drug for type 2 diabetes. If you were unable to get pregnant after taking Clomid alone, your physician can add metformin to Clomid, and the two of them can help stimulate ovulation and you eventually get pregnant. Then another drug that can be given to you to help stimulate ovulation is gonadotropins. It is a hormonal medication. Then there are other procedures too that can help you get pregnant. That is IVF. in vitro fertilization. Then there are medications that can help you reduce excessive hair growths and acne, which is also a major symptom of PCOS. We have birth control pills. Birth control pills can help reduce androgen, the levels of androgen. Androgen production causes excessive hair growth and acne, so birth control pills can help reduce the levels of androgen production. Another drug is spironolactone. This medication can help prevent the effects of androgen on your skin, thereby reducing the excessive hair growth and acne and all of that. But it is not advisable for you to take this drug if you are pregnant or you're planning to get pregnant. If you're planning to become pregnant or you're already pregnant, it is not advisable to take this drug. It can cause certain birth defects in your baby. So if you must take this drug, you're going to be on an effective birth control that is going to prevent pregnancy. This is it for this video. If you enjoyed watching, don't forget to click the like button, click the subscribe button, and join my little family. Turn on your notification bell because I have more informative and educative videos coming up soon on this channel. Stay tuned and thanks for watching.